Good afternoon, everyone, and thank you so much for attending your Cover to Cover training on the VA and the VA Benefits webinar series. This is part one of a two-part series. We're going to go ahead and get started. My name is Suzanne Obusick, and I work for PHW with Kay Gore. So she has graciously offered me this hour to bring this training to you. Jen Morgan is actually going to be our first presenter. She lives in Salt Lake City, Utah, and works at the Utah State University Center for Persons with Disabilities. She's the program manager for Cover to Cover and is working with Philadelphia VA team on an innovations grant. So Jen, whenever you're ready.
Hi, good afternoon. Thanks, Suzanne. I'm really excited to be here with you all today. As Suzanne said, I do live in Salt Lake City, Utah, and I'm excited to be working in collaboration with the Philadelphia VA on an innovation grant. My experience is program manager of the Cover to Cover program, and we'd like to share with you some of our experience in being a community-based organization and how we developed a model that helped us learn more about the VA, how to navigate VA, and how to work closer with our VA partners. So before we kick this off, we would like to throw a question out in the chat box. If you all could take a look at that. One of our first questions is, have you served in the military? And then the second question is, do you have a loved one who has served in the military? So if you have if you could pop on there and share your experience, that would be great. I think that many of us have had a connection with a family member that has served in the military, and many of us have heard how it's been a little frustrating maybe at times to access VA or understand how the VA system works. So that's great. I see some comments coming in. Okay. All right, well, we'll keep those coming in. It will be helpful for us to kind of learn about where everyone is and how you maybe have been touched by those who have served. So we are going to do a two-part webinar series on VA and VA benefits, and I have the agenda up here for you all to look at. Today I'm going to be covering a little bit about the Cover to Cover program, go over ways of how you all can learn how to navigate the VA, and how building relationships between agencies can really help support streamlining services, service coordination for veterans, and benefits and services that they might receive. And then we'll have Kathleen Clark that's in from the Coatesville VA Medical Center. We'll be covering VA healthcare, eligibility, and enrollment. And hopefully we'll have a little bit of time of Q&A. So if you have any questions throughout the webinar today, please put them in the chat box. And also, just to give you a heads up, we do have a survey link at the very end of the presentation. And you will be able to, if you have your iPhone, you will be able to just take a picture of it, and it'll take you directly to a brief survey. We really appreciate the feedback. And then hopefully you'll all come back and join us next week on part two, and we'll go over some military culture and some in-home services. And then I'm going to take you on a little surfing exploration of the VA website that will help you find your local contacts. So this training, we typically develop this training as in person, and since unfortunately we're all at home, we are providing these webinars and to give some overview, high-level overview of some of this information. And our hope is that someday we will be in the same room together, because it is really helpful to well, as we're all experiencing and really looking at how in-person is so valuable, that hopefully we can get together in the same room and learn more, and then also talk about maybe gaps that we can brainstorm together on how to better coordinate care. So just a little bit of background, the program was based on two things that we looked at. And one was a national survey that we had aging and disability resource center staff take nationally. And one of the questions that we asked was, do you regularly assess a caller's veteran status? No, we found that, around 95% always or usually ask that question. We really got the sense that this was a demographic, check the box, and kind of move on. And some of the feedback, I think many of us know that it can be challenging to try to find the right door to walk into at the VA, and that can be frustrating. But the most positive feeling that community-based organization staff really liked it if they had a personal contact and phone number that they could utilize as a resource. The second thing we took in account for was veterans' misperceptions, and we looked at a 2010 VA report that said only 41% of veterans stated they understood their VA benefits, a lot or some. So many veterans have they have misperceptions about connecting to the VA for benefits, and some could be that their income, they think their income is too high, that they aren't eligible because they didn't serve during combat, or during wartime era. And we hear a lot that other veterans are more deserving. And then some have negative attitudes about the VA and might be hesitant to reaching out. And so the reality is that many veterans actually don't connect to their benefits that they could be eligible for. So we took those two concepts and we submitted grant funding through the VA Office of Rural Health and developed a pilot project called Cover to Cover. And the acronym actually stands for Connecting Older Veterans, especially rural, to community or veteran eligible resources. And we felt like we could tackle this by providing training opportunities for community staff on VA benefits that would provide a new access point for veterans in their community. And then we would also develop relationships with the VA. And ultimately, what we found was we thought those would be two activities, training and then sitting at a table and developing relationships. But the training actually created the foundation and was the vehicle that developed those relationships because we were all in the same room together and swapping cards and talking about clients and members. So there we go. We kicked that off in 2013 in Utah and ultimately did replicate the program in 4 states regionally. So I wanted just to show you a snapshot of Pennsylvania veterans. Since I'm here in Utah, I wanted to take a look at your data. And so there are, as of 2017, 819,000 veterans living in the state. And I think what really popped out for me in this data was that the number of veterans over 65. So 55% is quite a large amount and a very large amount of Vietnam veterans. There's a link on this page if you want to learn more about the full report on your state summary. So the first thing we had to learn was navigating the VA and understanding what branch did what. And so there are 3 federal branches of the VA: Veterans Benefits Administration, the VBA, which covers things like pension, service connection compensation, those kind of things. Veterans Health Administration, VHA, that provides healthcare, in-home services, those types of things. National Cemetery Administration, the NCA, that deals with cemeteries and burial. And then each state has their own State Department of Veteran Affairs. So I pulled up your state Department of Military and Veteran Affairs. A link to their page is here. Each state has their own specific state benefits that veterans might be eligible for. They also have veteran service officers that can help veterans learn about their benefits and apply for, submit claims on their behalf. So this gives you a big picture of the Salt Lake VA. So we have the VBA, VHA, the State Department of Veteran Affairs, and the Veterans Home, all on the same campus. So when a veteran says, I went to the VA, there really needs to be a little bit more question on actually what door they walk through. And so they may have gone to the VBA and applied for a benefit, and maybe they weren't eligible, but that doesn't necessarily mean that they might not be eligible for a VHA, a healthcare benefit. And the different branches don't always communicate.
Record your message. When you have finished recording, you may hang up or press 1 for more options.
Hello, did I lose it, everybody?
I can hear.
Nope, you're good. Go ahead.
Okay. All right. So necessarily, you know, a veteran might have to walk into a doorway at VBA and VHA separately. So it's confusing to us on the outside as well as the veteran experience. So when we did our benefits training, this just gives you a sample. These are a lot of different topics that we could cover. But the ones I haven't read, the organizational structure, service branches, and military culture are really a great foundation to start. This will help working with staff at VA as well as communicating with your veteran members as well. And military culture, that is a piece. When we started this our training program, we didn't have that topic, and we really missed the ball on that. It's really important to understand military culture. It just gives you a way to build trust and rapport, and so that's a great topic to cover. So learning military culture and lingo. So here's some acronyms that are, some military or veteran VA acronyms, which, it can be very frustrating as we all of our organizations have acronyms. So, trying to learn those acronyms. And I just provided you a list with some of the, top acronyms that we've heard that we had to learn. And so this is for your reference, and there's also an additional link here if you'd like to look on the VA website. So learning the new culture and language, some of the ideas is participating on online training modules. There's some great resources through PsychArmor, which I'll cover later. Other ways you could invite a VA staff person to provide a presentation at your staff meeting, and I guess now we're doing it virtually, but virtually or in person. Or you might have those in your agency that have served, and that you could ask them to share more about military culture. The next thing we had to tackle is we're learning how to engage a little bit differently with our veteran clients, is that we changed our question from, are you a veteran, to have you or a loved one served in the military? And other questions, have you ever accessed your veteran benefits? Have you enrolled in the VA for healthcare? When did you serve? So it's really important to ask what we call in our training the right question, because many veterans don't identify as a veteran, and that could be for a number of reasons. Maybe they're younger, they didn't serve in a wartime era, female. So it's really important to ask them, have you served in the military? And asking that question, does build rapport and trust with veterans. And also it expands the possibility that you might be speaking to a spouse of a veteran or a widow. And widows they might be eligible for benefits. So it's just a great question to ask, and it really kind of casts that net a little bit wider. So our program intervention, this is just 1 year of our data of veterans that we served. And it was the first year that we added a new question that asked, have you ever connected to the VA prior to calling our agency? So we served 1,166 veterans statewide at our agencies, and 64% of them said they had never connected to the VA before. So we really knew that, you know, we were able to reach those that were calling the agency in need and maybe never had tapped into this benefit. And 17% of veterans surviving spouses were served through the agency's new screening protocols. And 43% of our clients were over 80 years old. So a large amount of veterans that had never connected, and, you know, it just became too overwhelming. So they just kind of gave up or just didn't know that they were eligible at all. So I pulled up some of your state data, and it showed that of those 819,000 veterans, that 42% are enrolled in VA healthcare and 15% are receiving disability compensation. So some of our experience, what we learned about the silos that happen within the branches of the VA, that it does take time to build trust between agencies and clients. And also it can take some time to build that trust within the veteran clients as well. Physicians treat patients and typically do not provide benefit information. And I think that that's just to show that that is you know, the healthcare is one doorway. And if a veteran's been there to get hearing aids for, you know, they're not necessarily, the physician's not going to ask them if they've applied for a VBA benefit. And then another thing is that many veterans may have applied and said that they were not eligible, but that may have changed. So it's important, you know, if a veteran has applied, that it's not just like a one and done, you can only apply once. Things may have changed. And that we've had the great experience that VA staff were always willing to give out their direct numbers and willing to provide trainings like this. And, you know, I think that they're really wanting to connect with the community as well. And we've had a great experience in many states as well as in Pennsylvania. So these are some resources for you. You will get copies of these slides. So this is just for your own surfing. And that's it for my section. If anybody has any questions.
Excellent job, Jen. Thank you. If anybody has any questions, if you want to go ahead and put them in the chat pod, we can entertain a few right now. So I have a first question that says, can a veteran receive services if they have a discharge or other than honorable?
And I will pass that on. I know that Kathleen will touch that on her section on eligibility with healthcare. So that will be gone. She'll address that on the next section.
Yes, there's a whole slide about it, so we could discuss that in a little bit.
Excellent. All right, that's actually the only question I see in the chat pod so far. We will entertain some more if we have some time at the end. So again, please keep your questions coming in the chat pod, and we'll go ahead and hand this over to Kathleen.
Hello, everybody. I'm Kathleen Clark. I work at the Coatesville, Pennsylvania VA, which is kind of a distant suburb of Philadelphia or Wilmington, Delaware. I am going to just talk to you today about veterans eligibility and enrollment and how to make that happen, or how to understand it a little bit more. I am at a disadvantage today. I was unable to get into the Zoom meeting itself, so I'm just here on the phone. So Susan, if you're doing the slides, I'm going to try to keep up with saying, please turn the slide for me. I want to start by introducing myself a little bit. I've been here at the VA for about 5 years. I've previously worked for the Department of Defense as a civilian for 6 years. My spouse served in the United States Air Force for 24.5 years. We raised 3 beautiful children during that time. And in fact, those children right now are both ROTC cadets at their various schools, trying to get into the Air Force themselves. So they must have thought it was a glorious life too. But I'm going to talk to you today. The overview is basic eligibility for VA healthcare, VHA enrollment groups. It's this stuff gets a little dry and complicated, so I do apologize. Medical benefits package, income thresholds, medical benefits package, basic eligibility for beneficiary travel, questions and points of contact. Next slide. To start with the definition of veteran for the VA healthcare purposes, a veteran is a person who served on active duty for 24 consecutive months unless service period was before September 7, 1980. Exceptions do apply, and that's why we always rely on our counterparts at the Veteran Benefits Association, because then, administration, I'm sorry, because they're the ones who can truly tell us if somebody is absolutely eligible for benefits or not. There are certain situations where a former or current reservist are eligible for veteran services, and that would be if they were deployed to a combat theater for various things and such as that. And I do want to provide a little bit of information about that the VA is an entitlement program that's funded by Congress, which may change depending on the Department of Veteran Affairs budgets, appropriations, and various authorizations or laws. It's a healthcare provider, not necessarily an insurance company. However, with putting so many of our services and everything in local communities right now, we're almost looking like an insurance company. And I frequently get asked, what insurance is going to be covering this? And I say, no, it's a VA benefit that's going to cover it. We have 8 VA medical centers in the state of Pennsylvania and 35 community-based outpatient clinics, so that we are in everyone's backyards as closely as possible. Next slide. Which veterans can receive VA medical care? Only enrolled veterans can receive VA medical benefits. To be enrolled, you have to actually apply for benefits. This involves submitting a VA Form 1010-EZ, which I have an example of towards the end of the program, and also a DD-214. We'll also discuss how you can access your DD-214 if they've lost it. So not everyone who has actually served their country can receive benefits through the VA, and that has to do with income thresholds and dishonorable discharges or discharges for bad conduct. And we'll also discuss that a little bit towards the end of the program. Next slide. To establish if you're eligible for services, the best thing to do is to contact either your local VA or the National VA itself, or your Veterans Benefit Administration. There's the website here that you can access or call. In the state of Pennsylvania, we also have Veteran Service Centers located throughout certain counties and everything. Veterans can actually approach them. They are trained people to know just the basics about the VA and to get you in contact with the right people. So the VA has the capability to verify a veteran's basic eligibility information, such as how much time they served, any service-connected disabilities or ratings that they were determined to have. That's basically like workman's comp stuff, and we're going to discuss that in a little bit too, or combat-related eligibility or disabilities. Next slide, please. So I don't know how many of you are aware of service-connected, but I know most of the people that I come in contact with or receive phone calls from, that's one of their first confusions, is what is service-connected condition? A service-connected condition is basically determined at time of separation from the military initially, and that's any type of exposures, injuries, medical emergencies that the veteran might have experienced while they were on active duty. This could range anywhere from our Ancient Orge exposures from Vietnam to drinking inappropriately filtered water at Camp Lejeune, a veteran who got so stressed perhaps and suffered a heart attack, veterans that had terrible diets while they were serving their country and may have later developed diabetes. These are all things that can end up creating a service-connected condition for a veteran. If a veteran was determined to be no service-connected at the time of separation, there are ways that you can later on have a new compensation and pension evaluation to determine if your illnesses or sicknesses that you're experiencing maybe in your 60s could have been connected to your service in the when you were in your 20s. Next slide. So the VA breaks everything down into priority groups. And the reason that we do that is because we are an allocated budget program. So we have to make sure that our most needed veterans or the most disabled veterans are definitely getting the resources that they need, possibly before some of our lesser priority group veterans might have an opportunity to get them. You know, sometimes that sounds a little cold or harsh, but it's necessary to make sure that the resources are allocated appropriately. So the priority groups were established for years when the budgets and appropriations are limited to make sure, of course, that our resources are available are most for for example, a 100% service-connected veteran that might be now in their 70s, just suffered a major stroke as a result of their historical service-connected conditions. Well, the VA has promised to take care of that, well, the country has promised to take care of that veteran for the rest of their lives. So that particular person could be referred to a bed on a military campus for nursing home services. And then that veteran will be cared for the rest of their lives in a military nursing home. Whereas perhaps maybe a veteran that might be only 70% service connected for their wounds or exposures, etc. If they also would be free, but a veteran that has maybe only 40% service connected, such as maybe like sometimes we see diabetes as 40%. And of course the percentages could always be calculated higher depending on how severe the disease or exposure or circumstance affected how much they could acclimate into society or work, essentially. So that 40% service-connected veteran would likely have a copay of $97 a day to stay in a nursing home if there was a resource available for that veteran. Next slide. So we're going to just discuss the priority groups a little bit. Priority groups 1 through 5 would be our highest priority for services and resources. Our priority group 1, of course, would be the service-connected veterans that are 50% or more rated by the VBA. Medal of Honor recipients, they're unemployable because of their service-connected condition. Sometimes we'll see like a PTSD veteran, for instance, in this category. They might be only 40 or 50 years old, but because of their circumstances or how bad the PTSD might be affecting their lives, they're not able to hold down a job. So the VA will make sure that all of their medical concerns and everything are taken care of. Priority group 2 is, you know, just, and it gets lesser and lesser with the service connected, but then it adds other things such as priority group 3 has Purple Heart or former POWs, if they didn't also have like injuries. So a lot of this kind of combines and is a formula that calculates out into what priority group they'll be in. Next slide. So priority group 6 is like environmental or combat issue or related stuff. So if you could think of this as exposures while they were serving. Were they exposed to combat status, were they exposed to emotional distress, things of that nature. And you can see here is where we get some of these particular veterans. Would be like the Southwest Asia Theater. And then we offer all kinds of programs and everything, which you'll learn about next week, based on these environments or combat situations. Next slide. Priority groups 7 and 8 are kind of like lowest in priorities, and these might be just your common, like what you would think of as your common GI. Maybe they served as in their career, especially for our voluntary military right now. They joined when they were 18, served for 20 years, had great careers in the military. Never really saw any combat or anything because we had a large stretch there where there was no real fighting, and but they're still eligible for VA benefits, and so this would be our priority group 7 and 8. Next slide. Combat veteran eligibility, we more or less kind of separate these veterans out because we know that there are an awful lot of possibilities for them to have been exposed to that might not be immediately known. So they served as active duty in the theater of combat operations after effective date of legislation from November 11th, 1998. So this would be your GI that essentially saw action. So service in theater of operations established by proof of receipt of global war on terrorism expeditionary medal, sorry about that, copy of orders or some other documentation indicating service in a combat theater. So you kind of have to prove that you're eligible for this level of care. We can also think of some of these veterans now as the younger generation that are sitting behind a very technical desk that might be sending a drone into a foreign land, wreaking havoc or causing a large bomb to occur and perhaps taking lives. So they might be sitting in the CONUS, which is the continental United States, and causing chaos in a foreign land. These young men and women we're finding are very, very stressed with what they're doing emotionally. Next slide. It's important to point out that people who have combat veteran eligibility, a lot of times our veterans, especially in our voluntary services right now, they'll join the service, serve their country, and maybe they were put on 1 or 2 deployments. When they return home, they decide that it's time to separate from the military. So we do have advanced enrollment priority group for this section, for this collection of veterans. They have to enroll within 5 years of their separation from active duty in order to be eligible for being a higher priority group for at least the first 5 years of their enrollment. Following 5 years post-enrollment, their priority group will then be determined on any type of treatments or anything that they may have received that would have caused any service-connected abilities or anything like that. Excuse me. Next slide, please. And hopefully this slide will help answer the earlier question. The veterans with other than honorable discharges. So an other than honorable discharge is usually somebody who perhaps got in trouble, was arrested in foreign land, did something stupid even on our, in the CONUS, or bad conduct. Bad conduct discharges we were seeing an awful lot during the draft years, because as you can imagine, if you tell your teenager that you want them to do something and they don't really want to do it, what are they going to do? They're going to act up. And that's what we saw an awful lot in that period where we were drafting folks, and they just really didn't want to be a part of their nation. And so then they would cause trouble or get in trouble, so they would be discharged. And these categories usually prevent eligibility for VA services. Another example of like bad conduct is sometimes, especially in this day and age of our voluntary services, is kids that are trying to escape a bad home life. Might think that if they join the military, then that's going to save and solve a whole bunch of things. But unfortunately, we find that there's an awful lot of latent, perhaps psychological issues or concerns there. And when they're put under the duress of a drill sergeant kind of, yelling at them, some of them their schizophrenia will be triggered, or other psychological illnesses. In this case, if a veteran is discharged other than honorably, they may be possibly eligible for mental health services. But it's pretty limited what they would be eligible for. Next slide. To discuss income thresholds a little bit, I know Jen mentioned this in her presentation, that some veterans think that have never tried to enroll for the VA because they thought that they made too much money. Well, there is some truth to that, and there is some confusion surrounding it, of course. The 1010 EC form that we're going to see here in a little bit does ask for an awful lot of financial information, and it does put you against a geographically adjusted income threshold to see if you would be eligible for care in your local community. So this is zip code dependent incomes. So say, for instance, you may have a veteran who makes $80,000 a year in Pittsburgh that might be eligible for care, but a similar veteran may be making $60,000 out in State College would also be eligible. So you can't really, it's like comparing apples to apples, apples to oranges, as far as a particular zip code and whether you would be eligible for care or not. So a lot of times our veterans do travel throughout the country, and so maybe they'll enroll for services down in Florida. From my understanding, if you're enrolled in the VA, then you're enrolled basically everywhere. So if they met all the financial criteria and everything and enrolled in Florida and then came to Pennsylvania, they can just transfer their care to the Pennsylvania VA. Next slide, please. Co-payment charges for certain veterans. This would be really like the lower priority group veterans. Anyone who has a service connection of at least 30%, I believe, or higher, usually don't have any co-pays that they have to pay for services. Also, certain income levels won't have to pay. Certain disabilities, maybe they're not service-connected disabilities, but they might be disabled because they're blind, that wasn't related to their veteran status. Or they might be a paraplegic from a car accident that they suffered after a military life. If that person's disabled, then they would also qualify for perhaps no co-payments and stuff while they're being treated at the VA. So to give you an example of what level co-payments we charge, for outpatient co-payments, to see your primary care provider is only $15. To see a specialty care provider is $50. Medication co-payments are also not all that bad. For 30 days or less, it's about $8. A 30-day supply or more could be around $9. But the stipulation with the pharmacy benefits is the medication has to be ordered by a VA provider. For community living center or nursing home placements, for eligible veterans, the copay is about $97 a day. For adult day health care centers, the copayment is $15 a day. The VA also offers like in-home respite or in-home skilled services. Skilled services so far it doesn't carry a copay, but in-home respite carries a $15 a day copay. And there's no copayments and no insurance billing for treatment of any service-connected conditions. Oh, and one other thing I want to add to that under this slide is there are certain programs within the VA that also don't carry any copayment because we want people to try to do preventative measures. And this would include individual or group smoking cessation, weight reduction services, and hospice care. Next slide. So the VA Comprehensive Medical Benefits Package for all enrolled veterans, they have access to preventative care services, colonoscopies, prostate exams, breast health, inpatient, outpatient diagnostic and treatment, so your MRIs, your PET scans, anything like that that is deemed clinically necessary by your VA provider can be ordered. Prescription services, and again, highlighting that the prescription has to be by a VA physician. Benefits that are limited to a certain priority group of veterans, mostly based on service-connected disabilities, would be eyeglasses, hearing aids, dental care, ambulance services, non-VA care or care in the community, prosthetics, durable medical equipment, rehabilitative devices, and of course long-term care. Next slide. The VA Comprehensive Medical Benefits that do not include this list, which is of course not an all-inclusive list, but just to give you some ideas. And what you could think of here is it's usually anything that is considered illegal at the federal level. So say for instance you're a veteran, you're registered at the Colorado VA, and you understand from a non-veteran that his chronic pain was being cared for by marijuana. No VA providers right now can possibly prescribe marijuana for any reasons whatsoever because it's still considered illegal at the federal level, if that helps understand things. Gender alterations, hospital outpatient care for a veteran who is a prisoner, inmate, or fugitive. Memberships to spas or health clubs is still not covered, and in vitro fertilization, etc. Next slide. Beneficiary travel overview, which can be very confusing and somewhat murky as well. VA authorizes to provide eligible veterans mileage reimbursement when medically indicated or special mode ambulance. So say the VA is paying for a veteran that self-presented to an emergency room, they further got admitted, and now they need to go to a skilled nursing facility. As long as the VA is authorizing every piece of that care, then they could have special mode or ambulance transport from the acute care hospital to the skilled nursing, for instance. Certain veterans who may be on hemodialysis 3 times a week, they're possibly eligible for mileage reimbursement, and it depends on their priority level of care. And next slide. So VA care and your other health insurance plans can also a source of a little bit of confusion. A lot of times we'll get asked as VA staff, I went to XYZ hospital, my other health insurance covered things, but I have a $250 copay. Will the VA pick that up? And no, the VA doesn't do any type of, I don't know if you would call it cooperative payments, or, and it might be better said on my slide, a share cost. That's what the terminology is. So we cannot do any share costs. So if the VA is picking up the bill for something, then the VA will more than likely be paying for the whole thing unless there's a copay involved. But we won't do cost share through other insurances. So if your insurance covers 80% of something, the VA is not going to pick up 20, or vice versa. But if the veteran presents to the VA for routine care, it's quite possible, if that veteran also has other health insurance, maybe through a spouse, that the spouse's insurance will actually get charged. Next slide. Urgent and emergent care. Right now, because of the Mission Act, it authorizes urgent care for in-network facilities. The veteran must be enrolled. They must have been seen by their VHA provider within 24 months. And like I said, they have to, it has to be an urgent care that's in network, and the VA has to be made aware of the treatment within 72 hours. This actually has recently changed, as of actually yesterday, where we're educating a lot of the urgent care facilities, local emergency rooms and everything, to have them start making the calls to our to like a national call center, so that the veterans aren't slipping through the cracks and their care is being paid for. Next slide. This is how to request copies of your DD-214 or other military discharge paperwork online. The best place to go to is the National Archives website, which is www.archives.gov. In here, you just hit on military service records and follow the instructions as it goes in. Once you're in this site and under military service records, if you scroll all the way down to the bottom of the page, there's even a YouTube video that shows you what happened, or actually how to fill the paperwork out and what happens once you click the button, and how everything flows through the archives office to get back to the veteran. They're saying that it takes about 10 business days or less to actually receive the document in your home, and they're saying that they're averaging about 6 business days right now. Next slide. On here, I know it's probably pretty small on the slide, but this is your 1010EZ form. This is the financial information that needs to be submitted with your DD-214 to determine eligibility. And we have to check this because of that global means test that we have to do. And the first 2 pages are essentially taking you through the next sections, which it's really only a 2-page application. And the first 2 pages are instructions on how to fill it all out. Next slide. And then that's just the application part. And the next slide is points of contact. For here at the Coatesville VA, I put our local contact information there. But since I'm under the understanding that I'm talking to perhaps service coordinators throughout the state of Pennsylvania, you can go to www.va.gov, and I believe that there is a link on there that could help you get in contact with your local VAs. And I'm pretty sure Jen is going to talk about that next week as well. Next slide. And if there's any questions, I know there was an awful lot of information. I do apologize for kind of being droney and just talking at you.
Oh, this has been great, Kathleen. Thank you so very much for providing that. Before I get started into the questions, I'd like to go ahead and get to the survey slide so that folks, while we're going through the questions, can take that picture of that QR code and make sure that you complete the survey on today's webinar. So before we're going, though, we're not going yet. We're going to go over some of these questions. You got quite a few of them here. Oh, and if for whatever reason our amazing team of Kathleen and Jen are unable to answer the question at this moment, we will take your questions aside and get you the answers after the webinar. Also, I would like to state that the recording of this webinar will be available for you out on your SCE YouTube channel. So if you don't have access to that, please reach out to your service coordinator account manager internally at PA Health and Wellness, and we will definitely get you that link so that you can, if you need to pass this along to folks in your companies that may have not been able to attend today, then that way they can view that. And then again, as I said, part 2 will be next week. And as you can see in the chat pod, Jen stated that she will be covering all PAVA MCs next week. So we'll talk more about that next week. So questions. The first one I had was, what about Army National Guard? Are they considered veterans?
Only if they have been federalized, and there is a code for this, and I apologize that I can't come up with the exact code, but a Pennsylvania National Guard personnel would have to be actually federalized and then activated onto active duty. So yes, it's possible, especially there. I think they were talking about actually in the news here recently because of all the riots and stuff.
Gotcha. Excellent. All right. Thanks, Kathleen. The next one is, do spouses of veterans qualify for any benefits at all?
There are a very limited number of spouses that can possibly be eligible for VA benefits. I leave that all to my colleagues at the Veteran Benefits Administration to answer, because there's real strict criteria that give them the eligibility.
Excellent. The next one is, like I said, there's quite a few. Are there benefits offered to veterans whom did not serve 24 months? And if so, is there access to a list of where those benefits might be that they could view?
Yes, if we go back to that slide, the 24-month obligation is only since, I think, 1980 or 1988. The laws prior to that depends on whether they served under a combat period. And I could probably research and get a better answer for that question if need be.
Okay, that's perfectly fine. Thank you. Is a veteran who served during peacetime eligible for any benefits?
Absolutely, yes. Especially if they meet the minimal criteria of the 24 months and they are not above the geometric means test. So in other words, if they serve during peacetime, maybe for their four-year obligation, sat at a desk in Arizona the whole entire time, they would likely be eligible for VA benefits. They would kind of be a low priority group, though.
Understood. So what would you suggest if a participant went through the VA for an injury that occurred during deployment or wartime, but the VA denied them the benefits and stated the injury couldn't have occurred while they were deployed, even though the participant has all documented paperwork?
I would definitely suggest getting kind of like a second opinion by going to the Veteran Service Organization, the VSO. That's who makes appointments for having your records and everything reassessed.
And this is Jen. I'll just interject. That's why I did put the State Department of Veteran Affairs, and it's really great to get on that website to understand more of what they do and what their veteran service officers do, but they're an incredible resource to you, but also to veterans. And it's definitely worth, as Kathleen said, is having someone else take a look at it.
Excellent, thank you. And can the VA help a veteran establish their eligibility, like finding the proof that they served in the theater of combat?
Oh, absolutely, yes. It's called a HINK, and I apologize, I don't know what, it's H-I-N-K, and the Veteran Benefits Administration or even a eligibility office at a local VA would be able to, yes, give them, if on their DD-214, it has an awful lot of really good information on there that people in the VA know how to use. And so it will basically tell them on that form where the veteran served, when they move from one station to another and everything. So there's an awful lot of information on that. That's why it's necessary in the application process.
Excellent, thanks. Just three more. So you had mentioned earlier if someone signed up for VA services in Florida and then moved to Pennsylvania, that they would still be able to visit any VA. So does that also apply to a veteran transferring from the U.S. territories such as Puerto Rico?
Absolutely, yes. In fact, when the Puerto Rican state of emergency happened with the hurricanes, we actually did service several Puerto Rican residents that were up here displaced because of the emergency. They had family up here perhaps, and then we were able to take them into our campus and help them. Mm-hmm.
Excellent. Does the VA offer visiting nurses to come to an individual's house to assist with something like wound care?
Absolutely. Yes, we sure do. As long as they're enrolled, they have a VA provider who ends up ordering it. And like I said on earlier, there's no co-payment for that particular service.
All right. And then the last question that I can see is that are veterans able to use benefits at a civilian hospital in case of an emergency when not near a veteran hospital, or do they pay out of pocket?
No. From the enactment of the Mission Act, our veterans can go to most civilian emergency rooms and have it completely covered, but there are criteria that need to be followed. So say I live in State College, Pennsylvania, and I show up at the local hospital. I get the care that I need for maybe a chest pain. I'm admitted for a couple days, but while I'm admitted, either myself, a family member, even the hospital itself, that's what we're trying to encourage the hospitals to start calling the VA directly, have to make the VA aware that you're there receiving services. We do a utilization review, and services will likely be 100% covered.
Excellent, thank you. And so that looks like the exhaustive list of the questions in the chat pod. If you do think of any, please feel free to send them to your account manager. As I did mention, this is only part one of our VA webinar series, so looking forward to all of you attending next week. And please take a picture of the survey. You can just use your camera phone, your smartphone, and take a picture, and it should take you right out to the post-training survey. I will also send the link to your account managers, who then will distribute it to you as well. I want to thank all of you for your participation, and thank you so much, Kathleen and Jen, for your excellent presentation today, and we're looking forward to next week.
You're welcome.
All right, thank you.
Bye.